So, the question has to arise as to how we can facilitate coping and resilience from errors and from other acute and chronic stressors that we experience in healthcare. And I think there's no one answer, of course. Our group did a study when I was at Brigham and Women's Hospital, and it was a physician study, and we asked about lots of different stressors. And one fascinating finding was that when we asked specifically about the stressor of having made a medical error, where would you want to get support from? 88% of the physicians that we surveyed wanted to be supported by a physician colleague, even though we had great employee assistance program professionals and mental health professionals. There's a real desire to actually be able to talk to someone who gets it, who's been there, who's had the same issues and experiences, and that's very, very reassuring to people. There was also another study that looked at those factors that correlated with developing wisdom and resilience after medical errors, again, also a physician study. And one of the factors that correlated with developing resilience, which can be defined as growth through adversity, was talking about it with colleagues. So the conclusion that we had and continue to have is that if you're going to try to help us during, in the aftermath of acute or chronic stressors, it's best to have at least the emotional first aid provided by a colleague, somebody who understands what you're going through. That doesn't preclude at all either informal peer support or more professional resources, but formal peer support where we have healthcare frontline clinicians trained to be able to help a colleague strategize and unpack what they're going through is just a bit different from either of those two.